This vaccine needs ultra-low temperature at -80 degrees centigrade to -60 degrees centigrade, mainly because mRNA is very fragile and can be degraded very easily. So for the vaccine to be viable and effective, this temperature is needed. Before administration, it will be diluted with 0.9% saline, which is basically sodium chloride. The dose of the vaccine administered is 30 micrograms contained in a 0.3 ml of the diluted vaccine. The second dose of the Pfizer-BioNTech vaccine may be given between 3 to 12 weeks following the first dose. This vaccine is administered as an intramuscular injection into the deltoid muscle. The objectives of the COVID-19 immunization program is to protect those who are at highest risk from serious illness or death. In the UK, the Joint Committee of Vaccination and Immunization, JCVI, have set out a prioritization list for persons at risk. JCVI advises that the first priorities for the COVID-19 vaccination program should be the prevention of mortality and the maintenance of the health and social care systems. As the risk of mortality from COVID-19 increases with age, prioritization is primarily based on age. If the course is interrupted for one reason or the other, the JCVI has advised that it should be resumed using the same vaccine, but the first dose should not be repeated. There is no evidence of the interchangeability of COVID-19 vaccines, so it's better to complete with the same vaccine. Switching between vaccine or missing the second dose is not advised, as this may affect the duration of protection. It's not known yet if booster doses will be needed, as there are still ongoing studies, but at the moment it's just 2 doses. No data for co-administration of COVID-19 vaccine with all the vaccine exists yet, so it's best to leave 7 days interval to avoid the incorrect attribution of potential adverse effects. As with most medicinal products, specific clinical trials of COVID-19 vaccine in pregnancy have not been carried out yet. So in the absence of safety data, there is insufficient evidence to recommend routine use of COVID-19 vaccine during pregnancy. If pregnancy is confirmed after the first dose, it is advised for the pregnancy to be completed before the second dose. The JCVI has advised that vaccination in pregnancy should be considered only where the risk of exposure to COVID-19 infection is high and cannot be avoided, or where the woman has underlying conditions that put them at high risk of serious complications of COVID-19. JCVI advises that breastfeeding women may be offered vaccination with the Pfizer-BioNTech vaccine. This mainly borders on the clinical need of the mother, and of course, there is absence of safety data for the vaccine in breastfeeding women at the moment. Children and young people have a very low risk of COVID-19 disease and death compared to adults, so the vaccine is not recommended for under 16s. Also, vaccine trials have only just begun in children, and there are very limited data on safety and immunogenicity in this group at the moment. Vaccination may be considered for children with severe neurodisabilities who tend to get recurrent respiratory tract infections and who frequently spend time in specialized residential care settings for children with complex needs. Individuals who have immunosuppression and HIV infection can still get COVID-19 vaccine. Many individuals who are clinically extremely vulnerable will have some degree of immunosuppression or be immunocompromised and may not respond very well to the vaccine. Therefore, those who are in this group should continue to follow government advice on reducing their risks of exposure as well as infection. This vaccine should not be taken by those who have had a previous systemic allergic reaction, including immediate onset anaphylaxis to a previous dose of the same COVID-19 vaccine or any ingredient of the COVID-19 vaccine. The Pfizer-BioNTech vaccine contains polyethylene glycol, also known as PEG for short. PEGs are a group of known allergens commonly found in medicines. Many household product and cosmetics. Non-allergy to PEG is very rare, but if you have had previous allergies to it, do not take this vaccine. The Oxford AstraZeneca vaccine does not contain PEG and may be used as an alternative. Whether PEG is the cause of the reaction in patients with systemic allergic reactions after the first dose of the Pfizer-BioNTech vaccine is unclear, but research is still ongoing. The MHRA has advised that individuals with a history of anaphylaxis to food, an identified drug or vaccine, or an insect sting can receive any COVID-19 vaccine as long as they are not known to be allergic to any of the components of the vaccine. You can speak to your clinician if you have any concerns about this. Minor illnesses without fever or systemic upset are not valid reasons to postpone immunization. If an individual is acutely unwell, vaccination may be postponed until they are fully recovered. This is to avoid confusing the differential diagnosis of any acute illness, including COVID-19, by wrongly attributing any change in the person's underlying condition to the adverse effect of the vaccine. Everyone having this vaccine will be kept for observation and monitored for at least 15 minutes just to make sure you're okay. Like all medicines, vaccine can cause side effects too, which are mostly mild and short-term, and not everyone will get them. Very common side effects include having a painful, heavy feeling and tenderness at the injected arm, which tends to be worse around 1 or 2 days after the vaccine. Also, you can experience tiredness, headache, general aches, or mild flu-like symptoms. In addition, a mild fever can occur within a day or two of the vaccination. If you get any side effect, it is important to still get a second dose, which is usually 3 to 12 weeks after the first dose. This will provide a longer lasting protection compared to just one dose. If you experience high temperature or fever, this might mean you have contracted COVID-19 or any other infection. If your symptoms seem to be getting worse or you are concerned, call NHS 111 if you're in the UK, or your healthcare professionals if you're outside the UK. Anyone can report any suspected side effect of the vaccine online through the Yellow Card scheme or by downloading the Yellow Card app on your phone. Evidence suggests that once an individual has had the vaccine, it is important to carry on following the recommended infection control guidance to reduce exposure and to prevent transfer of the virus to others.